if you have a vascular problem, our next guest can help you
That's
with
right.
that. Dr. Stout is here. This segment is sponsored by Ozark Regional Vein and Artery Center. Dr. Stout, welcome back. Good to see you.
Yeah,
Thank you. Thank you very much.
Yeah,
Absolutely.
Today we're going to talk about women's health. Is that right?
Yes.
Yeah.
Women's health is something that I've learned through practicing over the last couple decades is basically ignored, and you're told you're a woman, just deal with it, and that shouldn't be the case.
Sure.
So
Okay.
we're going to talk about a few subjects today and kind of get the word out a little bit.
Yeah,
Yeah.
absolutely. What are some atrial conditions that you do see and treat maybe that are common in women?
Some of the more common things in women that we find that's a little bit more obscure that people don't know about includes uterine fibroids. And amazing enough, if you look at all women, a majority of women will have uterine fibroids. And especially in the Black community, over 80% of women will get uterine fibroids by the time they're in their 40s. And the second thing that's kind of a big deal is when they have that pain, bloating, and they can't walk. At the end of the day, you just hurt, and that's pelvic congestion syndrome. So another little obscure type vascular problem that is easily remedied.
Yeah.
Okay.
Well, talking about easy remedies there, what are you able to do for these vein vascular diseases? How are you able to improve that?
Yeah. So with uterine fibroids, obviously we want to try prevention first. And one of the big things that women can do, especially when they're younger, you want to try and prevent these from happening because it's due to too much estrogen over time. So what can cause more estrogen? Well, having early onset periods, that can cause it. You can't really change that. You can try to avoid hormones that are in foods and processed foods, and try to avoid processed foods the best you can, because that is one of the big drivers of this. Nobody really knows why these benign tumors develop in the uterus, but that's one of the leading hypotheses. One of the things that we can do at Ozark Regional Vein and Artery Center is embolize these fibroids. So there's going to be 3 different treatment strategies, in addition to trying to prevent them. Birth control pills and non-steroidals such as ibuprofen or naproxen. Those can treat the symptoms, and those can help to alleviate some of the excessive bleeding, the bloating, the constipation, the little pooch that you have, and that can help that. But unfortunately, it's not successful all the time. So that leads to the other treatments, which most of the time it's going to be a hysterectomy. The majority of hysterectomies in the United States are performed for uterine fibroids, and most of these are under the women of the age of 40, which can be a tragedy, especially if they're still wanting to have children. And one of the things that we can provide is we can embolize these fibroids without having to do a surgery. We do it from the wrist, where we send a long tube through the arteries down to the fibroids in the pelvis, and we inject these little microspheres, is what they're called. They're really, really neat sci-fi things suspended in a fluid, and they preferentially seek out those fibroids and start to shrink them up and make them go away.
Okay.
Very nice. It beats having a hysterectomy or having somebody cut you open and do a myomectomies where they shell them out, but those are all open surgeries and take long recovery.
Well, let's talk about that recovery time a little bit too. What can folks expect in terms of downtime or recovery for a procedure like this?
So following a uterine fibroid embolization procedure, we do these as an outpatient. I'll do them first thing in the morning, mid-morning, and I'll watch whoever I'm treating all day, make sure that their pain is getting controlled. And over about 3 days, it's very uncomfortable, very similar to the type of pain with surgery, but then it starts to drop off. And the patients will go from taking pain medicine around the clock to where they only need to take it as needed. After about a week or so, you can return to work, normal activity, and versus surgery, you're going to be looking at 4 to 6 weeks down and trying to recuperate.
Yeah, absolutely. I think we can bring up the website if we can. That's where you can go if you are seeking an evaluation or even potential treatment. You can get more information on the website. Dr. Stout, good to see you. Thank you so much.
Yes,
for
thank you
coming on
guys
today.
so much.
Yeah.
No, we appreciate you. Thanks for joining us.
Absolutely.
Yeah.